So, hello everyone. I hope I'm clearly visible, audible to you people. Let me confirm. If I'm clearly visible, audible, I will start the lecture ahead. Okay. Let me see if I'm clearly visible. Okay, I hope it is working. Give me a thumbs up in the chat box. Those who are listening me, they can see me clearly. They can hear me clearly. Give me a thumbs up in the chat box. Okay, so let me move ahead. So I welcome you all for this session. This is the second session for today. I am Dr. Priyanka Sachdev here, educator on Unacademy, and today I am here to continue my series on pharmacology. I have started free YouTube pharmacology classes in which daily I take 3 hour session on pharmacology. We have started general pharmacology. In general pharmacology, we have started pharmacokinetics, right? So, in this lecture and next lecture, I'm going to finish pharmacokinetics completely. And from tomorrow onwards, we will start pharmacodynamics, right? That was the overview I want to give you, right? So, give me a minute. So, in pharmacology, we already know we have two branches, kinetics and dynamics. We have started kinetics. In kinetics, there are 4 chapters. Now, we have already finished absorption, distribution. In the last lecture, we have finished biotransformation or metabolism. And now I am starting a fresh start, excretion, right? You have to give me a minute to jump on the slide where we were so that we can continue from there only. I hope you all are the old students and you have attended the last lecture also. If you have not attended the last lecture, please watch the recording later on. So now you can attend this lecture and later on you can watch the recording. You can't afford missing that. So let me start with excretion. So here I am. Okay. So what is excretion now? You can understand. So listen, the same diagram, the master diagram in which I always teach you the things is this. You can see this is the drug. So anyone is taking a drug by oral route, by mouth. The drug is going in the mouth, it is going in the esophagus, it is going in the stomach, it is going in the intestine. Acidic drugs absorbed from stomach, basic drugs absorbed from intestine. Ultimately, the drug reaches in the blood vessel. So in the blood vessel, the drug, some of the drug got bound with the protein, albumin or alpha-1 glycoprotein, depending acidic or basic drug. So free form and bound form. After that, the drug go to the site of action, show its mechanism of action. Right, now drug wants to get excreted out of the body. The job of the drug is over. Drug has already shown its mechanism of action. Drug is not any more needed in the body. Now we want to excrete the drug out of the body. Now maximum excretion takes place via kidney in urine. So 90%, 90% of the drugs are excreted in urine via kidney, right? But for this, the drug has to be polar so that it can dissolve in urine. Urine is water. Before that, if the drug is non-polar, drug will go in the liver, get converted from non-polar to polar, and then polar drug will be excreted out of the kidney. This is known as metabolism. This was absorption. We have completed from the site of administration till blood. From blood to the site of action, this was distribution. So we have finished the first chapter absorption. We have finished the first chapter, second chapter distribution. We have finished the third chapter metabolism, that is conversion of non-polar drug to polar drug. And now we are moving to the last chapter, excretion. So excretion is the last chapter which I have to teach you here. So what is excretion? Passage of drug out of the body, out of the drug. Passage of drug out of the body. That is the definition of excretion. So this free drug will go to the kidney and get excreted out, right? Now, most of the drugs are excreted in urine, as I have told you, 90%. So I will tell you details of urine only kidney excretion. But there are few exceptions. The drugs excreted in feces, the drug excreted via lung in the form of the carbon dioxide, the gaseous drugs, right? The drugs are excreted in saliva, sweat, and breast milk of the mother. These can be other ways that constitute minor routes, minor. So we will see one line about these and then we will come on urine in detail, the kidney excretion, the urine in detail. So urine, I will teach you, it is the most important channel in detail, right? I will come on that a little bit, a few seconds after a few seconds. So let me teach you the feces. So yesterday, if you are an old student, you have attended my yesterday's lecture, you know what is enterohepatic circulation. Some drugs show enterohepatic circulation. So the drugs which are metabolized by glucuronide conjugation, they show enterohepatic circulation. And yesterday I taught you instead of urine, they are excreted in feces. So if the drug is large in size, this is the drug. It will absorb, it will reach here, it will go to the liver. Liver will convert the non-polar drug to polar drug by combining the drug with glucuronide. But during this conversion, the drug size is increased. Now, drug cannot come back in the blood. If the drug cannot come back in the blood because of increased molecular weight, it cannot go in the kidney for excretion. Drug cannot directly jump in the kidney. No, it will go via blood only. So drug cannot come in the blood because the molecular size is more. So what the drug will do? The drug will go from liver. There is a bile duct. There is a bile duct which come out. So drug will go in the bile duct, and via bile duct the drug will go in the duodenum. The bile duct open in duodenum via ampulla of Vater. So this drug, the big drug, the large drug, will go in the intestine again. In the intestine again. And from intestine it will be excreted in feces, not in urine. So that is, yesterday I taught you enterohepatic circulation. You can understand it is for few drugs. The drugs which is having more molecular weight more than 300 Dalton. So those drugs are excreted via enterohepatic circulation. They come in the intestine via bile, via bile. Give me a thumbs up. So yesterday we have understood this diagram very clearly. So you should learn the name of the drugs which is having high molecular weight because of glucuronide conjugation. So these are excreted in feces, not in urine. So these are the drugs. You can make some mnemonic. These are the drugs which are excreted in feces, not in urine, right? So that was about feces. Let me come on lungs. So which drugs are excreted in lungs? The drugs which are the drugs which are gaseous, which has a partial pressure in the blood. So it depends on the partial, it doesn't depend on the concentration of the drug in the blood. It depends on the partial pressure of some general anesthetic drugs, alcohol. These are the drugs which are excreted by lungs. Saliva, which drugs are excreted via saliva? Only 3-4 drugs. Lithium, iodine, rifampicin, and some heavy metals are excreted via saliva and sweat. And what about breast milk? Breast milk, the human breast milk, the breast milk of the mother. Which drugs are excreted? So in breast milk, the drug come via passive diffusion. So the drug which is more lipid soluble can come in the breast milk. The non-lipid soluble drug cannot come in breast milk. And especially basic drugs come in the breast milk. So these are the summary. So these are the minor routes of excretion. This is not major route. Minor routes of excretion of the drugs. The most major route of excretion is the urine, that is kidney. Via kidney. Kidney will form the urine and kidney will excrete the urine. So let me start kidney. Renal excretion. The most important major route. Ye sab pe one line you have to learn. You have to learn few examples of each of this. Question can come definitely. But the most important and difficult route to understand is renal excretion via urine. So let me start renal excretion. I want thumbs up from everyone before starting renal excretion. Give me a thumbs up. I want thumbs up from everyone before starting renal excretion. Let me see if I can see your chat. Yes, I can see your chat. Definitely. So let me start the renal excretion. see, before understanding this all, the complicated things. Now the things will become super complicated. I will try to simplify it by explaining you the anatomy of the kidney. You know, human have 2 kidney. Each human have 2 kidneys. We all have a pair of kidney. The structural and functional unit inside the kidney is the nephron. You know nephron. So nephrons are present inside each kidney. Each kidney have 1 million nephrons. So total humans have 2 million nephrons. 1 million in right kidney, 1 million in left kidney. We have 2 kidneys. Nephron is the structural and functional. So this is the diagram of a nephron. And kidneys have nephron inside it. So this is the diagram of nephron. You have to understand nephron have 5 portions. So what are the 5 portions of the nephron? You can see this is glomerulus. You can see this is Bowman's capsule and glomerulus. This is PCT, proximal convoluted tubule. This is loop of Henle. Loop of Henle have 2 limbs, descending limb, ascending limb. This is descending convoluted, distal convoluted tubule, DCT. And this is collecting duct, CD. So these are the 5 portions. Bowman's capsule, PCT, loop of Henle, DCT and collecting duct. These are the 5 portions of the nephron in sequence. Do you have any doubt in this? Do you have any doubt? Now can you see this is the renal artery. This is the afferent arteriole coming inside. Please understand this, Afferent arteriole coming inside the Bowman's capsule, forming a tuft of capillary and emerging out as efferent arteriole. Let me draw it. So let me draw a Bowman's capsule. So this is a Bowman's capsule and this is a Bowman's capsule and this is continuing as PCT. This is continuing as PCT. This is loop of Henle, DCT and collecting duct. This is the diagram. So Bowman's capsule is continuing as PCT. Give me a thumbs up. Give me a thumbs up. So listen, this is the afferent arteriole coming, forming a tuft. I am drawing only one tuft. There are multiple tuft of capillary. For the sake of understanding, I am drawing only one. So this is tuft of capillary and emerging out as efferent arteriole. So this is afferent arteriole coming here, forming a tuft of capillary and emerging out as efferent arteriole. Let me label it. You have to understand it crystal clear. Afferent arteriole carries the blood here. See the arrow. Form a tuft of capillary inside the space, the bowl, the Bowman's capsule, and emerge out as efferent arteriole. Everyone give me a thumbs up. Now the substances which enter here, the substances which are entering here via afferent arteriole, the substances which are supposed to get excreted in urine, they will filter out. They will filter out here and get collected in the space here, and then they will be driven here in the PCT loop of Henle, and ultimately they will excreted in the urine ultimately. So this step is known as glomerular filtration, the first step. Everyone give me a thumbs up. This is the first step, glomerular filtration. So via in the capillary, whatever substance which are supposed to get excreted out of the body, it can be a drug, it can be vestigial material, it can be uric acid, it can be creatinine, it can be a drug also, right? So the drug will filter out here, come out of the capillary and get collected in a space known as Bowman's space. And from Bowman's space, it will go in PCT. Give me a thumbs up. This step is known as the first step, glomerular filtration. I will explain you 3 steps, and the mechanism of each step at each step. It is difficult. Again, I am saying it is difficult. I am warning it is difficult. So please concentrate on your gadgets, right? So this step is glomerular filtration. Do you have any doubt? And the remaining substance, which is not supposed to get excreted, will go back in the efferent arteriole. So all the substances are coming. Some substances got filtered out here, and the remaining which are not filtered, they will go back. They will go back. Give me a thumbs up. They will go back in the efferent arteriole. What will happen to this efferent arteriole? Just a second. What will happen to this efferent arteriole? Now, do you know what will happen to this efferent arteriole? Listen, the story is very beautiful. This efferent arteriole will form the capillaries over the tubules. This is known as vasa recti. But tubules, I mean all 4. PCT, loop of Henle, DCT, and collecting duct. So same capillary will come and continue as peritubular capillaries. Can you see? So the same substances are coming here. Okay, the same substance, the remaining substance are coming here, and they are just forming a capillary just adjacent to all these tubules. By all these tubules, I mean PCT, loop of Henle, DCT, and collecting duct. So they are from these capillaries. These are known as peritubular. These all are tubules. The 4 tubules. These are known as peritubular capillaries. So efferent arteriole is continuing as peritubular capillaries. First, afferent arteriole is coming. It is forming a capillary, and capillary is continuing as efferent arteriole. Efferent arteriole is continuing as peritubular capillary. Give me a thumbs up. Everyone give me a thumbs up. Now consider a peritubular capillary and see the substances inside it, which were continuing from here. The remaining substances in the efferent arteriole, they will go in the peritubular capillary. Now 2 things will happen in the tubule. 2 things, listen, understand this very clearly. 2 things will happen in the tubule. Okay. Some things will be absorbed here. यहाँ पे कुछ चीजें छूट गई. Some things were left here. Those who want to get excreted, many things will be excreted. 80% will be excreted here. They will come here via glomerular filtration. But 20% still want to get excreted, but they didn't got the time to get excreted, and they just go flow away in the efferent arteriole. Now they want to come in the urine. They want to get excreted. So from the tubular capillary, they will come directly in the tubule. Give me a thumbs up. This step is second step. This is known as tubular reabsorption. What it is known as? So after glomerular filtration, the second step is tubular reabsorption. Everyone give me a thumbs up. Tubular reabsorption. Everyone give me a thumbs up. Everyone. That is tubular reabsorption. The second step. And few substances are coming in the urine. They don't want to get excreted, and they will go back in the blood from the tubular lumen. So this step is known as tubular secretion. So total 3 steps are there. Glomerular filtration, tubular reabsorption, tubular secretion. Give me a thumbs up. Everyone give me a thumbs up. Now see this diagram. The same diagram the author has given us. See, can you see a Bowman space? Everyone give me a thumbs up if you all can see a Bowman space. The blue is the Bowman space. This is the Bowman space continuing as PCT. This is continuing as PCT. Everyone give me a thumbs up. Can you see a afferent arteriole, everyone? This is the afferent arteriole. Coming inside, forming tuft of capillaries, multiple tuft of capillaries, and emerging out as efferent arteriole. Give me a thumbs up. So all the substances coming here, the substances which are supposed to get excreted will filtered here. So you see this diagram. They will be filtered here. So the first step is glomerular filtration. Do you have any doubt in this diagram? Do you have any doubt in this? So the first step is glomerular filtration, which will happen here. After that, this is afferent arteriole. See, beautiful diagram. Afferent arteriole going forming tuft of capillary, efferent arteriole coming out. And after coming out, the efferent arteriole is forming peritubular capillaries over all the tubules. That is PCT, loop of Henle, DCT and collecting duct. Give me a thumbs up. So the same diagram, same diagram. Now see the beauty of the diagram. You yourself see the beauty. You yourself see the beauty. So this is afferent. This is the last diagram I'm explaining you. Then I will go on mechanism of the 3 steps. You should understand the 3 step. I'm again explaining you. So this is the afferent arteriole coming here. Everyone see? Afferent arteriole coming here. It is forming a tuft of capillary and efferent arteriole is going out. Look at the arrow. The efferent arteriole is going out and efferent arteriole is forming a peritubular capillary which is in parallel with the PCT. Do you have any doubt in this? So see, this is the drug coming in the blood. This drug want to get excreted. So some of the drug will be excreted here, maximum drug. So this step is glomerular filtration. But some drug will go away. It is not getting time to get excreted here. So it will go away in the peritubular capillary. From the efferent arteriole, it will go in peritubular capillary. From the peritubular capillary, it will be reabsorbed here again. So this step is tubular reabsorption. And some extra material is also coming here which do not want to get excreted. They will again go in the blood. So tubular secretion. So total 3 steps are there. Glomerular filtration, tubular secretion, tubular reabsorption. Give me a thumbs up. Give me a thumbs up. I'm telling you. Okay. Have you got it? Do you have any doubt in this? If you have any doubt, please ask specifically. So this is the master diagram from KDT in which I will explain you all. Let me see. Okay, tubular absorption, tubular secretion. Let me tell you this formula. So let me form a glomerulus. So this is a sketch diagram I would like to draw for you. So this is the glomerulus. This is the Bowman's capsule. This is PCT. This is PCT. And this is afferent arteriole. Everyone see? This is the capillary. This is efferent arteriole. This is afferent arteriole. This is capillary. This is efferent arteriole. And this efferent arteriole is continuing here as peritubular capillary, which is parallel to the PCT. This is PCT, now I told you this is PCT. So just parallel to the PCT, this is peritubular capillary. Now everyone see? So drug is coming here. I'm drawing the drug with green color. So drug have 3 things. Number 1, some of the drug will get filtered here in the capillary. So this is step 1. It is known as glomerular filtration. Everyone give me thumbs up for the first step. Do you have any doubt in this step? So this is the first step. This is the first step. Now the drug is going back in the efferent arteriole. From the efferent arteriole, the drug will come in the peritubular capillary here. Now in peritubular capillary, 2 things will happen. Listen the 2 things. The first thing, the drug will come from the blood to the lumen and some drug will leave the lumen and go to the blood. So see the arrows. This I am telling you, this is tubular secretion, this is tubular reabsorption. So see what is coming in the lumen, that will form the urine. So urine with 2 things are coming. One is leaving. What 2 things are coming? So glomerular filtrate is coming and tubular secretion is coming. But tubular reabsorption is leaving. So what is the formula? The net formula is glomerular filtration plus tubular secretion. The net answer minus tubular reabsorption. So this is the formula I want to explain you. So this is written in front of you. It is glomerular filtration plus tubular secretion minus tubular reabsorption. Do you have any doubt in this? So I will explain you all these 3 details in one by one. Can you see this diagram? I will simplify this diagram for you. Don't worry. Draw this diagram. Look at this diagram. In the end, you will be able to understand this. This diagram is from KDT. Now see this diagram. See this diagram. Do you have any doubt in this? See the black color Bowman's capsule. This is Bowman's capsule. This is Bowman's capsule. And this is PCT. Continuing as PCT. PCT. Do you have any doubt? See the afferent arteriole. It is coming inside. Look at the arrow. Look at the blood vessel. Forming a tuft of capillary and look at the efferent arteriole going out. This is efferent arteriole going out. And efferent arteriole is continuing as peritubular capillary, which is parallel to PCT. I want thumbs up from everyone. If you understood this now, you will be able to understand ahead everything. If you don't understand anything, the next 1 hour will be wastage of you. You will not understand anything. This is the master diagram. Everyone give me a thumbs up. See the drug. Now you will say, ma'am, in blood, you told us that drug is present in 2 forms. See the purple color. So this is the free drug, not bound with the protein. And this is the bound drug. Can you see? Yellow is the protein. So it is bound with the protein. So drug is present in FD, BD. FD is the free drug. BD is the bound drug. Give me a thumbs up. See the capillary. See the capillary is lined by endothelial cells. Everyone see. Everyone see. And between 2 endothelial cells, there is a space. Appreciate that space. There is a space between 2 endothelial cells. Drug will come out from the capillary to the Bowman space via this space. So which drug, common sense, which drug will come out, free or bound? The drug which is smaller, that can only cross that space. The drug which is larger in size, having high molecular weight will not be able to cross this space. The space between two corresponding a small space is present. Everyone tell me which drug will come out. The common says that ma'am only free drug will come, bound will not come. So it is shown here, yes, only free drug will come in glomerular filtration. The first step. Bound drug do not show glomerular filtration. It will go ahead because the size is more. It cannot cross the space between two corresponding capillaries. So this is the space between two corresponding capillaries. Bound drug cannot cross the space because it is larger in size, because here the drug is attached with the protein. So because of this, combination is larger in size. Only free drug will show the first step. Three steps I have to teach you. Glomerular filtration, tubular secretion, tubular reabsorption. So here in glomerular filtration, the summary is that only free drug will cross, bound drug will not cross. Do you understand this? So this is the first step, glomerular filtration. Because the pores, by pores I mean the pores between two corresponding endothelial cells in the capillaries. The pores are very small. So pores are very small. So only free drug, only free drug. Now it doesn't depend this free drug is lipid soluble or lipid insoluble. It doesn't depend. It is the free drug. It doesn't depend on lipid solubility. Whether it is lipid soluble or insoluble, both will cross. The limiting factor here is the size of the drug. So only free drug will cross. Bound drug will not cross. It does not depend. This step, the glomerular filtration, does not depend on lipid solubility. Second step, tubular secretion will depend on lipid solubility. But this step doesn't depend on lipid solubility. This step depends on the size. And via size, only free drug will cross, bound drug will not cross. Give me a thumbs up. Now, how much drug is free and how much is bound? Total 100 milligram is there. From the 100 milligram, how much is free or how much is bound? Who will decide that? Who will decide that? So free will cross and bound will not cross. Who will decide the proportion? The proportion is based on plasma protein binding. You already know the term plasma protein binding. So there are some drugs which is having high plasma protein binding, PPB, and there are some drugs which is having low plasma protein binding. I'm sorry, you already know the list of the drugs. The drugs which is having high plasma protein binding and the drugs which is having low. So high plasma protein binding means high bound form and low free form. Yes or no? And low plasma protein binding means low bound form and high free form. So it is the plasma protein binding which will decide that proportion. So can I say glomerular filtration depends on, it depends on plasma protein binding. It does not depend on lipid solubility, but it depends on plasma protein binding. That is the summary of first step. Should I come on second step? Should I come? So this is the summary of the first step. So the first step you should say, madam, this is afferent arteriole. Okay, just a second. This is afferent arteriole. Blood is coming. Drug is also coming. In the afferent arteriole, two drugs are present. One is free drug, one is bound drug. So in the capillary, only free drug will come in the filtrate. Bound drug is not coming because the space between two corresponding capillary, the pores are very small. So only free drug can cross, bound drug that cannot cross. So it is the molecular size which will decide. It is the plasma protein binding which will decide. Is it lipid solubility? No. Whether lipid soluble or insoluble, both will cross. Lipid solubility is not the criteria here. So first step is over. The name of first step is glomerular filtration. I am done with glomerular filtration. You should ask me second question. Madam, what will happen to bound drug? It is going ahead in the efferent arteriole and it is going here in the peritubular capillary. How you will excrete it? It is still present in the blood. I want to excrete all drug, whether it is free or bound. So free to ho gayi excrete. It is coming in the urine. Free is already there in the urine. What about bound? How bound will come? How bound will come? Give me a thumbs up. Give me a thumbs up, everyone. So I have explained you what is glomerular filtration. Now, before coming to tubular secretion, I will explain you what is tubular reabsorption. What is the arrow here? What is the arrow here? You tell me. Glomerular filtration, this is the arrow. So glomerular filtration, the drug is coming in the urine. Tubular reabsorption, blood is leaving the urine. So some additional drug is there that will leave the urine and again go in the blood. So that is tubular reabsorption. And last step will be tubular secretion, in which blood drug will again come in the urine. So this is urine, this is blood. See the arrows. See the arrows. Clearly see the arrows. From urine to blood, it is tubular reabsorption. From blood to urine, it is tubular secretion. And from blood to urine only, it is glomerular filtration. Give me a thumbs up. I tried hard. I tried hard. So I'm explaining you the second thing, tubular reabsorption. Let me start tubular absorption. It is difficult. The second step is most difficult. Tubular reabsorption. Tubular reabsorption will depend on two things, lipid solubility and pH. Ionization means pH. And now comes the role of the pH. Lipid solubility and pH. Listen, everyone see here. Once the free drug is inside, you can see, you can understand this diagram. Till now, do you have any doubt? Anyone have any doubt? Please ask. Do you have any doubt till now? So the first step is already over. Glomerular filtration is already over and free drug is already coming in the lumen. This is free drug. Bound drug is not coming. That I will tell you later on what will happen to this portion of the drug, the bound drug. Later on, how it will come to the urine, I will tell you later on. First, concentrate on this free drug. Once it come in the urine, now the free drug is of two types. Whether, listen everyone, listen, whether it is lipid insoluble or lipid soluble. It is of free two types. Either it will be lipid soluble or it is lipid insoluble. Give me a thumbs up. If it is lipid soluble, here are the cells now. How I should tell you. The PCT is lined by cell. So this is PCT. Just a second. This is PCT. This is lined by the cell. This is PCT. It is lined by the epithelial cell. Yes or no? If the drug is lipid soluble, please mind my words. Lipid soluble. Lipid soluble will cross the cell. Cell is also made up of lipid, now cholesterol membrane, the bilipid layer membrane. So it will dissolve and it will cross and it will again go back in the blood. It will not excrete it. It will not remain in the urine. It will cross. And lipid insoluble cannot cross, so it will be excreted in the urine. So the free drug is of two types. If it is lipid soluble, from the urine, it will cross the membrane, it will cross the epithelial cells and go back in the blood. Go back in the blood. Give me a thumbs up. So it is the tubular reabsorption. This step. So tubular reabsorption takes place of lipid soluble drug. Lipid insoluble drug do not show tubular reabsorption and it is excreted in the urine. Give me a thumbs up. You have to give me a thumbs up. That is the first possibility. So free drug is of two types. What are the two types of free drug? What are the two types of free drug? It is lipid soluble and lipid insoluble. Who will show tubular reabsorption? The first step, glomerular filtration, is shown only by free drug, not by bound drug. What will happen to bound drug? I will tell you its story of bound drug later on. We will continue the story later on. But concentrate on free drug. Only free drug is coming, bound is not coming because of the size of the pores. Okay, we got it. The first step is over, glomerular filtration. Once the free drug is in the lumen of PCT, this is PCT. PCT के lumen में, it is of two types. Either it is lipid soluble or it is lipid insoluble. If it is lipid soluble, it will move back in the blood. Right? It will show tubular reabsorption. And if it is lipid insoluble, it cannot move back. So only option remaining is excretion. So it will be excreted. Right? So lipid soluble drug show tubular reabsorption and reabsorbed inside the blood. It will move from urine to blood. And lipid insoluble drug cannot show reabsorption. So only option, it will be excreted out of the body in the form of the urine. I'm trying hard. The second possibility. Now it is difficult. The second possibility. So the first thing, tubular reabsorption depends on lipid solubility. I told you this. So lipid solubility, if it is lipid soluble, it will show tubular reabsorption. Yes, it will show tubular reabsorption. If it is lipid insoluble, it will not show tubular absorption. It will excretion. It will show excretion. You know what is tubular absorption. So that is the first possibility. Second possibility, depending the drug is acidic or basic. Now let me tell you. So free drug again of two types. See, this is the free drug. Can you see here? Everyone see here. Before starting this, I want to tell you my golden rule. Do you know my golden rule? The drug is of two types, ionized form and unionized form. Ionized drug and unionized drug. Ionized drug and unionized drug. What do you mean by ionized and unionized? We always take the example of an acidic drug. This is the acidic drug and this is the basic drug. Acidic drugs have a proton in it, like HCl, HCO3, right? HNO3. And basic drug have a hydroxyl ion in it, NaOH, KOH, yes or no? So do the split here also, do the split here also. It is H positive, A negative, here A positive, OH negative. So here. What is the split? Everyone see. So drug kahan pe hai? This is unionized drug, the complete drug, and this is ionized drug, the splitted drug. Here it is unionized drug, and here it is ionized drug for acidic and basic. Please learn what is the meaning of unionized and ionized. Unionized का मतलब होता है complete drug. It is not splitted. It is complete. A is the drug, right? A. So A is present with H and A is present with OH. So it is complete. And this ionized drug मतलब splitted. Already it is splitted. So it is an ion. It is not complete. It is an ion. A negative. I'm sorry. This one नहीं. ये वाला है. A negative or A positive. Either A negative or A positive. It is the ionized drug. Give me a thumbs up. The summary I have already taught you in the last lecture. Unionized drugs Unionized drugs are absorbed. Anionized drugs are absorbed and ionized drugs are excreted. I have told you yes or no. Those who are listening my lectures from the very first day, they already know. If you have not listened this, just learn this. If you are listening it first time, please understand the concept. What I am telling you, unionized drug is the complete drug and ionized drug is the ion, A positive or A negative. So unionized will be absorbed. Please learn it. And ionized will be excreted. This is a rule. This is a rule. I can't change it. This is a principle. I can't change it. Please learn it. If you understood this, now come on the next story. So see, this is a free drug. Now free drug have two forms, ionized and unionized. Give me a thumbs up. Now what is the proportion? I don't know. Two possibilities are there. Maybe 10% is this, 90 is this, or maybe 90 is this, 10 is this. I don't know. This 90-10 proportion depends on the pH of the urine. This is the urine now. In the background, there is a urine. The lumen of the PCT, the background have a liquid, the urine, the water, right? The urine. So pH of that medium will decide whether the ionized is less, unionized is more, or whether the ionized is less, unionized is more. The proportion will be decided by the pH. I will come on that point. Don't worry. Give me a thumbs up till now. Give me a thumbs up. So the summary is that some drug is unionized and some drug is ionized. What I have told you, the golden rule. Who will repeat the golden rule? Unionized. Unionized will be absorbed. It will show tubular reabsorption and it will be absorbed in the blood. It will go in the blood, right? It will go in the blood. It will show tubular reabsorption. And ionized cannot be reabsorbed. So only option is excretion in the urine. Have you got it? Have you got it? Have you got it? So see the summary. See the summary of the two. See the summary of the two. So lipid soluble will be absorbed. Lipid insoluble is excreted. Unionized will be absorbed. Ionized will be excreted. So two criteria of tubular reabsorption. Who will show tubular reabsorption? This will show. This will not show. This will show. This will not show. Tubular reabsorption. Reabsorption means absorption. The other which is not showing the reabsorption, that will be excreted. Give me a thumbs up. So these are the two criteria for which tubular reabsorption is responsible. So lipid soluble, insoluble. So soluble will show, insoluble will not show, and it will be excreted. For ionization, two forms are there. Um, uh, Unionized drug and ionized drug. So unionized drug will show tubular reabsorption, it will go in the blood, and ionized will not show tubular reabsorption and it will be excreted. Give me a thumbs up. Everyone give me a thumbs up. Everyone give me a thumbs up. Till now, is it okay? Now you should ask me, ma'am, you were talking about pH. So complete the pH. What is the proportion of ionized or unionized? That will decided by the pH. That will be decided by the pH. Give me a thumbs up. Now imagine the pH is acidic. Imagine the thing, the pH is acidic, the pH is acidic, or imagine the thing, the pH is basic, the pH is basic. So here, okay, let me see. If the pH is basic, you want opposite medium to get excreted. So if the pH is basic and okay, so two possibilities are there, right? Let me tell you the summary. For excretion, opposite medium is required, right? If you have acidic drug, if you have acidic drug, or if you have basic drug, see, acidic drugs are excreted in basic medium and basic drugs are excreted in acidic medium. Everyone give me a thumbs up. Why acidic drugs are excreted in basic medium? Because for excretion, you require ionized form. So acidic drugs are more ionized drug at basic medium. That's why they will be 90% ionized, so 90% will be excreted in basic medium. And basic drugs are more ionized in acidic medium. Have you got it? Have you got it? So this is the summary you have to understand. This is the summary. So weak bases ionize more and weak acids are ionized more at the opposite medium. At the opposite medium. Have you got it? Have you got it? Yes or no? You tell me. You want it again? Just suppose this drug is basic. This drug is basic. This drug is basic. Now you take opposite medium. You take the medium acidic. The background medium is acidic. The drug is basic. The medium is basic. The medium is acidic. The medium. So here ionization will be 90%. Opposite medium में maximum ionization होगा, so maximum excretion होगा. Right? And if the drug is acidic and the medium is basic, the background medium is, the drug is acidic, but the background urine is providing a basic medium. So 90% of the drug is ionized. So maximum ionization ke liye, maximum excretion ke liye, you require opposite medium. That is the summary. Give me a thumbs up. Everyone give me a thumbs up. So it is the background urine which is providing the medium, whether acidic or basic. Whether acidic or basic. Give me a thumbs up. Everyone give me a thumbs up. So imagine a person, imagine a young boy who has tried to commit suicide by ingesting a basic drug. He has ingested a basic drug, 100 tablets of basic drug together. He wants to get suicide. Now parents are in front of you. Doctor, please save my child. We want to save our child, save the child. So you want to save the child, so you want this basic, he has ingested a basic drug, right? So basic drug is there in the urine. So in the urine, this is the basic drug. Can you see? This is the basic drug inside the person's urine. Now, what do you want? You want excretion or you want reabsorption? What do you want to save the child? For saving the child, we don't want reabsorption. We want excretion. So if we want excretion, we want more ionized form. If ionized form is more, it will be excreted. If ionized more, it will be absorbed. Yes or no? So we want more ionization. So if we do the opposite medium, the drug is basic now. If we provide acidic medium in the urine, so drug will be excreted because more ionized form will be there. And reverse, if this boy has ingested an acidic drug to commit the suicide. So there is another boy who has tried to commit suicide by ingesting 100 tablets of acidic drug. So all the drug is present here. Now there are two options. If the urine, the drug is acidic and the urine is basic, so there will be more ionized form and it will be excreted. And if the urine is acidic only, there will be more unionized form and it will be excreted. It will be reabsorbed. So what? So you have to either acidify the urine or basify the urine. Is it possible to do so? Yes, we can do both. If you want to acidify the urine, you can do this. If you want to do the basification of the urine, you can do this. So there are certain drugs, certain protocols by which we can change the pH of the urine depending on our need. So you are a doctor, there is a suicidal case in front of you. The first thing you should see the empty strip what the boy has ingested. So you have to decide whether that drug is acidic or basic, that you should know. So depending on that, you have to do opposite medium of the urine for excretion. If he has ingested acidic drug, you want to save the child, you want acidic drug to get excreted, you provide basic medium of the urine. The drug will be excreted because in basic medium, the acidic drug will be ionized form, maximum ionized, and ionized form is excreted. And if the boy has ingested basic drug, you acidify the urine. So you can save the child by providing opposite medium of the drug. If the drug is acidic, do urine basic. If the drug is basic, do urine acidic, so that the opposite medium में drug is excreted. Same medium, if you provide by mistake the drug is acidic and you also acidify the urine by mistake, you got confused, you will lose the boy. The boy will be dead because in same medium, the drug will be absorbed in the blood. So he will have toxicity of the drug and the person will die. Give me a thumbs up if you got it. So summary is that for absorption, same medium is required, and for excretion, opposite medium is required, depending what drug is it. So we have two types of drug in the world. So we have acidic drugs and we have basic drugs. We have basic drugs. Give me a thumbs up. Give me a thumbs up, everyone. So if we want to absorb acidic drug, if we want to excrete acidic drug, if we want to absorb basic drug, if we want to excrete basic drug, give me a thumbs up. So what medium you will provide? What medium you will provide? You tell me. So for absorption, same medium is required. So for acidic drug, you require acidic medium. For basic drug, you require basic medium. Please write down these mantras, right? And for excretion, opposite medium is required for excretion. For acidic drug, you require basic medium to excrete it. And for basic drug, you require acidic medium to excrete it. So depending on situation to situation, you can change the pH of the urine. If you want the drug to get excreted, provide opposite medium. In case of suicide, if you want to get drug absorbed, provide same medium. So how you can change the pH of the urine? If you want to basify the urine को basic बनाना है. If you basic मतलब alkaline, the same thing. So give IV infusion of sodium bicarbonate. So start a drip of sodium bicarbonate. Automatically urine will become basic in nature. If you want to do the acidification of urine, start 2 drips. The first drip is arginine hydrochloride followed by ammonium chloride. So if you do this, the urine will become acidic. Give me a big thumbs up. Give me a big thumbs up. So till now the concept is clear to you. Should I summarize the concept? Yes or no? Should I summarize the concept? Let me summarize. So I hope you people may have confusion because it is a difficult topic. So let me summarize. So let me form a Bowman's capsule which is continuing as PCT. So this is the PCT. Let me form another diagram. Okay. So this is the diagram. So this is continuing as PCT. So let me form a afferent arteriole, a capillary, a efferent arteriole, which is continuing as peritubular capillary. Do you have any doubt in this diagram? I guess you don't have any doubt in this diagram. I hope so, right? Okay. So I will teach you two things here. The first step is glomerular filtration. Now purple is my drug. So this is my drug. It is coming here Now drug is present in two forms. So this is the free drug and some of it is the bound drug. So I'm drawing both. So one is free, one is bound. So the first point is that only free drug will show glomerular filtration, bound will not show because of the pore size. That is endothelial cells के बीच में जो pores है, the free drug can cross that pores, bound will not cross that pores. Give me a thumbs up. So glomerular filtration is shown by the free drug, not by the bound drug. So glomerular filtration depends only on plasma protein binding. That is how much is the free, how much is the bound. If free is more, it will cross. If bound is more, free will not cross. So that is the thing. So it doesn't depend on pH. It doesn't depend on lipid solubility. That's it. So here is the free drug we are already having in the lumen. Now we will take two possibilities. Free drug. This is free drug. Bound drug abhi tak nahi aayi. Bound drug baad mein story bataungi. I will come on that story. Now this free drug have two options. Either it is lipid insoluble, lipid soluble and lipid insoluble, right? And either it is unionized and ionized. So two possibilities I am taking. So free drug can be lipid. So this is the lipid solubility is the criteria, and here ionized and ionized pH is the criteria. Give me a thumbs up. Give me a thumbs up after coming in the lumen of the PCT. I am talking about these two criteria. So take the first criteria. Take the first criteria. Take the lipid solubility. Lipid soluble drug will show tubular reabsorption and they will go in the blood back. Lipid insoluble drug cannot do the reabsorption, so they will be excreted out in the urine. So that is the summary of lipid solubility. Let me come on ionized, unionized. Unionized form of the drug. If the drug is unionized, it will reabsorb in the blood and it will show tubular reabsorption, it will go back in the blood. But if the drug is ionized, it cannot be reabsorbed. So only option, it will be excreted in the urine. It will come here, it will come here, it will be excreted in the urine. Give me a thumbs up. Give me a thumbs up. So these are the two criteria. So what is the criteria for glomerular filtration? The criteria for glomerular filtration is plasma protein binding. It doesn't depend on lipid solubility, it doesn't depend on ionization or pH. The criteria for the second step tubular reabsorption. The second step tubular reabsorption. There are two criteria. First is lipid solubility and second is pH. Lipid solubility, the answer is that lipid soluble drugs show reabsorption and lipid insoluble show excretion. The ionized and unionized ka formula is that unionized drugs show reabsorption. They will move back to the blood and ionized drugs show excretion. This is the formula. Now the second step, the second thing, this one, it depends on pH. So let me tell you the pH also, the last thing, the pH. So there are two types of drugs, acidic and basic. So opposite medium is required for excretion and same medium is required for absorption, right? So if the drug is acidic, you provide basic medium, it will be excreted. You provide acidic medium only, it will be absorbed, depending on ionized and unionized form. Because for excretion, you require ionized form, and for absorption you require unionized form. So if you provide the summary, this is the golden, ये छोटा सा है लेकिन सबसे बड़ा है ये, please learn. If you provide same medium, the drug will be unionized, that's why absorbed. If you provide opposite medium, the drug will be ionized, that's why excreted. Give me a thumbs up if you have understood it, it's good. If you have not understood it, learn this table. Learn this table. You have to learn this table for solving all your MCQs. Everyone give me a thumbs up. Everyone means everyone. So that is the second step. The last step I'm coming is tubular secretion, the third step. We have seen the factors of glomerular filtration, only one factor, plasma protein binding. We have seen the factors for tubular reabsorption, two factors, lipid solubility, whether soluble or insoluble, and ionization, whether ionized or unionized, that is pH. So two factors are responsible for this. So this was difficult. The third one is tubular secretion. First you tell me what is tubular secretion, hota kya hai? Now you should ask me the story, what will happen to bound form, ma'am? I'm sorry. You told us that there are two drugs, the free drugs and the bound drug. You already told free drug is coming here, showing glomerular filtration. Now free drug is of two type, whether lipid soluble, insoluble, ionized, unionized. You told us the story of free drug. But what will happen, ma'am, to the bound drug? You didn't tell us. Okay. The bound drug is moving here from the afferent arteriole to the capillary in the efferent arteriole. From the efferent arteriole, the bound drug is coming in the peritubular capillary. See, here is the bound drug. Can you see bound drug here? Everyone, what will happen to this bound drug? Now I want this bound drug to get absorbed and come in the urine. I want it to the urine. Now I want this bound drug also to get excreted. Bound drug cannot cross it. Bound drug will change into free drug only. They are interconvertible now. So bound drug will convert into free drug only, and this free drug will come here in the urine and get excreted. So all the bound drug will get converted into free drug. and that free drug will come here. This step is known as tubular secretion. See the arrow, it is coming from blood to urine. In tubular reabsorption, it was coming from urine, it was going from urine to blood. It is not from urine to blood, it is from blood to urine. Give me a thumbs up. Everyone give me a thumbs up. Everyone give me a thumbs up. So here a transporter is required. Can you see a transporter for the free drug? Free drug will come, it will sit on the transporter, and transporter will carry the free drug from blood to urine. So transporter, it is, can you see here? This is the free drug. See the purple drug, everyone? So first bound drug, all the bound drug will get converted into free drug. So there is zero bound drug now, 0% bound drug. Everyone give me a thumbs up. And all the free drug present in the capillary, it will sit on the transporter. See green color transporter, everyone appreciate. And via this transporter, the transporter will carry the drug from the blood to the urine, and this is how it is excreted here. So here it is transporter mediated mechanism. Here a transporter is required. In glomerular filtration, no transporter is required. Drug was directly coming via pores. Give me a thumbs up. In tubular reabsorption also, the drug was directly going in the blood via diffusion. No transporter was required. But here it is not diffusion. Here it is transporter mediated active transport or carrier mediated transport. A carrier or transporter is required. Give me a thumbs up. गिव मी अ थम्स अप. ये सब देख के कुछ क्वेश्चन आया क्या किसी के दिमाग में? किसी के दिमाग में कुछ क्वेश्चन आया? एनीवन वांट टू आस्क मी एनीथिंग? अदरवाइज आई विल आस्क द क्वेश्चन. यू शुड आस्क अ क्वेश्चन हियर. You should ask a question here. So I told you the what will happen to bound drug. So I have told you the story of free drug. So the story of free drug is in front of you. It is coming here via glomerular filtration. After coming, two possibilities are there, and either it is diffusing back or excreted. Right? That is the summary of free drug. What about bound drug? Bound drug is traveling here and coming here. All the bound drug getting converted into free, and that free is coming back in the blood using a transporter. So there are different transporters for acidic drug and different transporters of basic drug. We have two types of organic transporter. Organic acid transporter for the acidic drug, organic basic transporter for the basic drug. Give me a thumbs up. Everyone give me a thumbs up. What question you should ask me? You should ask me. I am telling you this question, but it should be question from your side. You should ask me, ma'am, that you are telling that all the bound drug is getting converted into free drug, and then free drug is coming in the blood because bound cannot come. So why not this happen in glomerular filtration? Here only you are saying that only free is coming, bound is not coming. So why not you convert it bound to free here only at the first step, and all the drug is coming. So you should convert all the bound here into free, and then it should come here. So bound यहाँ पे बचता ही नहीं, no bound is there. You should ask me, ma'am, why this conversion not happening here? And you are saying the same conversion taking place here but not here. So yes, I'm telling you, the conversion do not take place in the capillary. Here in the capillary, the conversion takes place in the peritubular capillary, vasa recta, peritubular. Why so? Because of the flow of the blood. Here flow of the blood is very fast. There is no time of conversion. Here the flow of the blood is slow. So there is time for conversion. Everyone give me a thumbs up. So it was a silly question, but a good answer. So students usually ask me this question. Everyone give me a thumbs up. I tried hard. I tried hard. Kuldeep, no transporter there. I got your point. But if there was time, the blood flow is very fast here, now. But if it was slow, so here also the bound get converted into free, and free can come directly like it was coming through the pores. But here conversion का time नहीं है. That is the problem. Time क्यों नहीं है? Because blood flow is very fast. That is my answer. Have you got it, Kuldeep? Have you got it? Does everyone got it? So I have finished the three mechanisms. Just a second. I have finished the three mechanisms. I have already finished the three mechanisms of excretion. Do you have any doubt in this? So there are three mechanisms. Glomerular filtration, in which drug is coming from the capillary into urine. From the capillary into the tubules or the urine. Tubular secretion, in which drug is coming from the peritubular capillaries into the urine. But here a transporter is required. Here it requires a transporter, via transporter. And tubular reabsorption, here reverse. Blood is going from urine to the blood, to the capillaries. So you can see 2 plus and 1 minus. Do you have any doubt in this? So the summary of the three things is in front of you. The three summaries are in front of you, crystal clear summaries. See the first step, this is glomerular filtration. It depends only on plasma protein binding. Only free drug can cross, bound cannot cross. After coming here, there are two possibilities, either lipid soluble, insoluble, or ionized, unionized. Unionized can be reabsorbed, ionized excreted. Lipid insoluble can be reabsorbed, and lipid insoluble can be excreted. So that was the summary of this, and it is pH dependent. Opposite medium is required for excretion, same medium is required for absorption. That was the summary. The third is for the bound drug. All the bound get converted into free, so bound will become 0%, and that free will require a transporter to carry the drug from the blood into the urine. So this is the summary of all. So it depends on transporter. So tell me the criteria of all steps. So for glomerular filtration, the criteria is plasma protein binding. Give me a thumbs up. For tubular reabsorption, the criteria are two: lipid solubility and ionization, that is pH. These are the two. And for the third, tubular secretion, the criteria is only one: transporter, availability of the transporter. It depends only on transporter, nothing else, nothing else. I tried my best. I tried my best. So I taught you, just a second, I'm sorry. I taught you the three mechanisms: glomerular filtration, tubular reabsorption, tubular secretion. The three steps of the excretion and the criteria for each of them. Here the criteria is plasma protein binding, only free drug can cross, bound cannot cross. Here criteria are two: lipid solubility and ionization. Ionization. So lipid soluble get absorbed, lipid insoluble get excreted. Unionized get absorbed, ionized get excreted. This is the summary. And here comes the role of pH. So opposite medium is required for excretion and same medium is required for absorption. We know the summary. And tubular secretion, only transporter is required. For acidic drug, acidic transporter. For basic drug, basic transporter. So these are the criteria for the three, and you know the directions. If you know it, everyone give me a thumbs up. I would like to launch some polls and you all have to participate in the polls. The polls are really difficult. Give me a thumbs up. I'm waiting for your response. Everyone give me a thumbs up. If you got it, we will launch some polls and move to the next topic. Everyone, so please answer me in the chat box. Please answer me in the chat box. So acidic drug is more ionized at which medium? Alkaline medium, pH medium, neutral medium, or none? I want acidic drug to get ionized. Ionized drug क्या होती है? I have told you the golden mantra. What is the golden mantra? Ionized drug and unionized drug. The ionized drug is excreted and unionized drug is absorbed. So ionized drug को excreted पढ़ो. Now read the question like this. Acidic drug is excreted at. For excretion, you require opposite medium. So for acidic drug, you require basic medium. Yes, you all are right. The correct answer here is alkaline. Everyone give me a thumbs up. Everyone. Kuldeep, Abhinami, Shoche, you are absolutely right. So correct answer is this. And if I change the question, instead of acidic drug is more ionized, more unionized कर दूं तो more unionized at. So what is your answer at in that scenario? Unionized matlab absorption. So I'm asking acidic drug is more absorbed at. For absorption, you require same medium. So acidic hai, to answer will be acidic. In that scenario, your answer will be B. Yes, very good, very good. Your answer will be B. Other people are also getting apart from these three students or not getting. So everyone give me a thumbs up. Not only these three students, everyone should answer. Give me a thumbs up those who are listening. Have you got the question? If you even have a slightest doubt, please let me know. I will repeat it. Please tell me. So you know the concept. You can see here. I have told you very clearly about the acidic and basic drug. Now coming on the next question. This is the next question. Alkalinity of the urine is done in. So you want to, this is a suicidal case. So there are 4 suicidal patients in front of you. So first patient tried to do suicide by ingesting barbiturate. Second patient tried to commit suicide by ingesting lithium. Third patient tried to commit suicide by ingesting alprazolam, sleeping pill. And fourth by diazepam. So there are 4 patients, right? Now, in which of these patients will you do alkalinity, basification of the urine? Alkaline matlab basification. You will do basification of the urine in which poisoning, in which the drug is acidic. So in short, I want to ask which of the drug is acidic. Opposite medium is required for excretion. Now, you want to excrete the drug. All of them are poisoning cases. You don't want absorption. It is a poisoning case. It is a suicidal case, poisoning case, toxicity case, or overdose case. You want the drug to get excreted. You want the drug to get excreted. So for excretion, opposite medium is required. You are giving alkaline medium. So drug should be acidic. So which of the following is an acidic drug? That is my simple question. That is my simple question. So some students are saying A, some are B, some are C. So learn the examples. Learn 2 examples of acidic drug. Very important. 2 examples of acidic drug. It is barbiturate and salicylate. Barbiturate and salicylate. And 2 or 3 examples of the basic drug. Morphine, amphetamine, and atropine. Learn 3 examples of the basic drug. Now learn. These are very important. These are very important. So what I am asking, which of the following is the acidic drug? So answer is barbiturate. Barbiturate is one of the acidic drug. Please learn. Please learn. Barbiturate and salicylate, that is aspirin. These are acidic drugs. So learn barbiturate and salicylate. These are acidic drugs. And morphine, amphetamine, and atropine. MAA. These are basic drugs. There are many examples, but these are most common examples which come in your exam. Everyone give me a thumbs up. So answer is not A, B. Answer is A, not B, C, D. Everyone give me a thumbs up. So that was a simple question. So it based on the knowledge also, concept also, and you should have a knowledge about acidic and basic drugs ka list. So you should know the list. I have given you an extensive list. If you can learn that list completely, it's good. If you can't learn the important one. Everyone give me a thumbs up first. So coming to the next question. This is the next question in front of you. Who will solve? Let's see who will solve it first. Alkalinization of urine is done for. You want to basify the urine. Alkaline matlab basify. You want to basify the urine for which drug? You want to excrete which drug? So you will basify the urine. So opposite medium is required for excretion. You want to basify the drug, basify the urine for acidic drug. Now acidic में two option है, weak or strong. What you will say? Weak or strong? No, strong acid, no, Kuldeep. Strong acid is not pH dependent. Weak acids and bases are pH dependent. So answer is A, not C. Answer is A. For strong acids and basic drugs, there is pH independent. They are pH independent. pH dependent are weak. In the last lecture, I told you clearly, it is weak. Answer is not B, Shotshe. It is A now. It is A. Why you are saying B? Listen, read the question again. Shotshe, please read the question. Kuldeep, read the question again. Everyone read the question. So I am doing basification of the urine. Why I will do this? You are a doctor. You want to basify the urine. Why you will basify the urine? You know the concept that opposite medium is required for excretion. So you want to basify the urine for some acidic drug. If that acidic drug toxicity is there, then only you will basify the urine. No? So which acidic drug? Weak acid or strong acid? Only two confusions are there. It is not strong. It is weak. So answer is A. Base का तो सवाल ही नहीं है. There should be no confusion in base. Everyone give me a thumbs up. Everyone. So questions are difficult, but if you have the concept, you can solve them. So answer is A here. Everyone give me a thumbs up. Everyone. This is the next question in front of you. A highly ionized drug. What is true about it? About the ionized form of the drug. You know ionized and unionized. Two types of drugs. Two forms are there. Ionized is the form which is excreted. And unionized is the form which is absorbed. Now read the option. So, which is correct? Yes, Abhirami. Yes, Rishinika. Yes, A is correct. It is excreted by the kidney. Ionized form is excreted. Yes, yes. It can cross the placenta. No, it will not be absorbed. It is absorbed. No. It will accumulate. No. It will be excreted. So, rest three options are true for unionized, but not for ionized. So, correct answer here is A. Yes, very good. This is the next question. Again, if you know what are acidic drugs, what are basic drugs? Acidic drug का list बताओ. Basic का list बताओ. Who will tell me? I taught you two acidic drugs, barbiturate and aspirin, salicylate or aspirin. Or basic drug में morphine, amphetamine and atropine. Please learn this list. Now solve the question. Solve the question. I have already given you the information. Solve the question. Alkaline diuresis. Diuresis यानी urine. You are making urine basic. You are basifying the urine. Alkaline मतलब basic. You are making urine basic. Why you will make the urine basic? Why at all you will make the urine basic? Because your patient have ingested some acidic drug and you want to provide opposite medium for excretion. So which of the following is the acidic drug? That is the question. Which of the following is the acidic drug? So barbiturate or salicylate में से जो भी option दिख जाए. It is not morphine, it is a basic drug. It is not amphetamine, it is a basic drug. It is not atropine, it is a basic drug. So answer is phenobarbital, which is one of the barbiturate. Yes. So barbiturate, one of the barbiturate is phenobarbital. So correct answer is C. So rule out other three options also. So everyone give me a thumbs up. So this is how questions can be framed. This is how. Now I can change the question. Instead of alkaline diuresis, I can make acidic diuresis. So other three options will become correct. Other three options. So I can make multiple questions in front of you based on these concepts. Everyone give me a thumbs up. Do you have any doubt in this? Do you have any doubt in this? So if you want to excrete the acidic drug and basic drug, listen. Okay, I want to show you something here. Just a second. Last concept. After that you can definitely leave. Just a second. A big concept. Let me show you this diagram. Listen here. Listen. So you are ingesting. Two possibilities are there. You are taking a drug. Everyone see. You are taking a drug. The drug can be acidic. The drug can be basic. You don't know. So whatever drug you are taking, it is going inside. Now you know the golden rule. Golden rule is that same medium is required for absorption. Opposite medium is required for excretion. Please learn the golden rule. Now apply these both rule here. So this is drug A, acidic or basic. You are taking any of the drug, right? So if the drug is acidic, it will be absorbed from stomach. because same medium, stomach have acidic medium, so acidic drug will be absorbed from acidic medium. And if the drug is basic, it will be absorbed from intestine, so basic drug will be absorbed from intestine. That is basic medium. Do you have any doubt in this? So acidic and basic drug already reached, so here you want to provide the same medium. For absorption, you want to provide same medium. For acidic drug, you want to provide acid in the stomach. For basic drug, you want to provide base in the intestine. Do you have any doubt in this? Once the drug is reaching in the blood, it is already showing its site of action, the mechanism of action. It is already converted into non-polar to polar form in the liver. I'm not interested in that. We have done the distribution, we have done the metabolism. Now drug want to get excreted in the kidney. Now drug want, now the same drug you want to get excreted. So you have to provide the medium again here. Now for absorption, we have two different organs. Listen, understand. We have stomach. In stomach, we have acidic medium, and we have intestine. In intestine, we have basic medium. So we have two different organs, stomach with acidic medium and intestine with basic medium. But we have only, so for absorption, we have two different organs with different pH. But for excretion, we have only one organ, kidney. So kidney have urine inside it, urine inside it. So we can change the pH of the urine accordingly, whatever is the drug. You got my point? So we can acidify the urine, we can basify the urine. Now if the drug, now opposite medium will be required, right? So if the drug is acidic here, this is the acidic drug going in the kidney. Just a second. This is the acidic drug going in the kidney. Please excrete me. And this is the basic drug which is going in the kidney. Please excrete me. Both of them are already polar. They have converted into non-polar. Both of them are polar. Now kidney want to excrete both of them. If the kidney want to excrete the acidic drug, the urine should be basic. Then only it will be excreted. If the kidney want to excrete basic drug, the urine should be acidic. Then only it will be excreted. For excretion, opposite medium is required. So please see the summary is in front of you. For absorption, same medium is required. For excretion, opposite medium is required. I cannot simplify more than this. So sometimes you want absorption, sometimes you want excretion. So if you want absorption, provide same medium. If you want excretion, provide opposite medium. So the drugs are acidic or basic. Again, mind my words, these are weak acidic or basic. Because for strong acid and base, pH is not a criteria. I am done. I am done. Everyone give me a thumbs up. Only Kuldeep has given the thumbs up. What about rest? You have not got the concept. So this is the master diagram you can see. So pH concept is applied here also, and pH concept is applied here also. So during absorption also we require pH ka funda. For absorption, same medium is required. And for excretion also, we require pH ka funda. For excretion, opposite medium is required. For absorption, we have two different organs. One is acidic, one is basic, stomach and intestine respectively. But for excretion, we have only one organ, that is kidney. But inside kidney, there is urine. And we can change the pH of the urine, acidic and basic, according to the drug. So if I am taking any drug, just suppose I am taking aspirin. I am having headache or I want a blood thinner, I am taking a tablet of aspirin. We all know aspirin is an acidic drug. So if I take aspirin with a glass of water, it will be absorbed from stomach. That is the first thing. It will not absorb from intestine because it is an acidic drug. It will be absorbed from stomach. Once it is absorbed, it will go in my blood. It will show its mechanism of action. It will show its metabolism, whatever. Now I want to excrete aspirin. So aspirin will go in my kidney. So my kidney may, if I want to excrete out of the body in urine, so pH of urine should be basic. pH of urine should be basic, then only it will be excreted. If pH of the urine is acidic, it will not be, it will be again reabsorbed. Give me a thumbs up. I tried hard to explain you the concept. So concepts are important. Concept. Have you got it? Give me a thumbs up if you got it. Everyone give me a thumbs up if you got it. Everyone means everyone. So please give me a break for again 10 minutes. At 1 p.m. I will start the third lecture, the last lecture. It is a small lecture, but don't dare to miss it. It is a very important lecture in which I am going to take the order of kinetics. Very, very important. So thank you very much for being with me for this lecture. Give me a break of just 10 minutes. After 10 minutes, I will start my third lecture at 1 p.m. sharp. Right? In the third lecture, I will teach you order of kinetics. Don't forget to write. It is a half-hour lecture only, 30 minutes from 1 to 1:30. So don't miss it. It is very important, right? So don't forget to write your feedback in the comment box. Whatever you feel for this lecture, please feel free to write. And don't forget to click on the like button if you like this lecture. Please follow my profile link on Unacademy. For the newcomers on Unacademy, we have two types of subscription, and plus you will get only Unacademy access. In Iconic, along with Unacademy, you will get access to PrepReader also. So these are the features. We will provide you the separate batches for various courses, right? And these are the various plans under Plus. These are the various plans under Iconic. Check the prices. Whatever plan comfortable to you, you can go with that plan. But if you apply my code Sachdev10 in any of these plan before payment, you will get maximum discount. So please learn the code. It is SACHDEV Sachdev10. It is applicable on all these plans. Thank you very much for being with me and join me back after 10 minutes. Bye bye. I am ending this lecture. Join episode number 9. Episode number 9, pharmacokinetics, the last episode.